This website is an attempt to integrate alternative medicine with mainstream medicine by incorporating the new neuroscience of the placebo effect. Instead of alternative and mainstream, I suggest that we use the terms non-pharmacologic and pharmacologic. I will explain how non-pharmacologic treatments can be safe and effective without deception in a fully informed patient. These therapies include things like, for example, acupuncture, chiropractic care, homeopathy, but also hypnotherapy and psychotherapy, and many aspects of the doctor-patient relationship. Pharmacological treatments involve ingesting a physiologically active substance, and surprisingly, both together often can provide the best outcome. Non-pharmacological therapies can work by misperception, of course, but what I am talking about here is how they can work by altering the function of brain chemicals called neurotransmitters. A non-pharmacologic therapy can alter the level of a neurotransmitter, for example, such as an opioid, that results in pain reduction. Other neurotransmitters that can do this include antihistamines for nausea, norepinephrine for depression, serotonin for obsessive-compulsive disorder, and acetylcholine for immune function. Other neurotransmitters that we think may be able to do this to some extent include dopamine, GABA, glutamate, and many others. This is what I mean by placebo medicine. We have been able to demonstrate that altering neurotransmitters can achieve general benefits such as relief of pain and nausea, but much more research is needed to prove that this can affect an underlying cause of illness. I believe that non-pharmacologic therapies cannot kill bacteria or fix a congenital anomaly or cure a neurologic disease or eliminate cancer cells all by themselves. However, there are a few specific conditions that they can treat, and they can help patients with many other conditions achieve better outcomes if they are also receiving traditional or approved, FDA or AMA approved medical treatments. The specific conditions that non-pharmacologic interventions can treat effectively all by themselves include pain, nausea, depression, obsessive-compulsive disorder, and anxiety disorders. Well, also, of course, psychosomatic illness. Psychosomatic means that the illness is primarily psychological or due to psychological factors. In other words, it's all in your head. This may seem like a small list, but this list represents a huge number of patients that can be treated with placebo medicine. On this site are books, essays, articles, research articles, videos, podcasts, and links that talk about the use of placebo medicine in medical and psychiatric practice. There are also sections that talk about cannabis and multiple sclerosis, which are classic examples that kind of live right on the threshold between alternative medicine and mainstream medicine. In the past, when medicine was an art practiced by a medicine man who never heard of a placebo-controlled trial, treatments were arrived at through experience or through intuition. Well, guess what? Patients got better. And the most powerful tool in the medicine man's kit was placebo medicine.